Hi, everyone. I'm Joseph Schmidt. I'm the Director of Solutions here at Save the Storks. And today I'm so excited to kick off our first Pregnancy Resource Center Town Hall meeting. And thank you all so much for joining us. This is our first webinar in a series of 4 Town Hall meetings. And we hope that today's topic, which is serving your community in crisis, is going to provide practical, timely, and valuable information to you and your pregnancy center. Before we get started, I wanted to invite you to email us any questions that you'd like answered in this town hall meeting. Please use that email that you see at the bottom of your screen, questions@savethestorks.com, and we are going to do our very best to answer each and every one of those questions. And to those that we can't answer, we are going to try and get back to you as soon as we possibly can. Someone from my team will get back to you. A little bit about me before we get started. I've been here at Save the Storks for about 2.5 years. My role is to oversee our teams that reach out to pregnancy centers and serve them, and also our Stork Bus mobile medical program. I also have been married about 11 years, have 2 amazing kids who would probably, they're kind of an unknown factor. So right now I'm over at my mother-in-law's. I'm very thankful for that, thankful for her. Joining me today is Becky Fizzell. She's the Director of Events here at Save the Storks. Becky's been with Storks for about 2 years. She's married to Tim, and actually Becky is expecting a little boy, which we're very, very excited about. Becky, would you mind sharing a little bit about yourself?
Yeah, thank you so much. Like Joseph mentioned, my name is Becky Fizzell, and I'm the Director of Events at Save the Storks, which means I'm usually in the background. So me on camera right now is a little intense, but hopefully we'll get through it. But my background is kind of all over the place, anywhere between working in the corporate world, helping opening up branches of company, to doing overseas missions and coming back and training the missionaries, to even the fashion industry. So it's kind of been all over. I've been blessed to be a part of a lot of things. And now I'm blessed to be a part of this pro-life nonprofit ministry called Save the Storks. And I've been with Save the Storks for 2 years. And I'm so honored to be a part of this. And I have been married to a wonderful man for 6 years. And we are expecting our first little boy in June. So yeah, just really excited to be here and to be, talking with you guys today.
Awesome. Thank you so much. Our guest today is Dr. Karysse Trandem. She is the Medical Director and OBGYN with the Pregnancy Resource Centers of Southwest Florida. She's also an OB hospitalist, physician, and surgeon at HealthPark Hospital in Fort Myers, Florida. Dr. Karysse, tell us a little bit about yourself, your medical career, the community you serve. We just love to hear more about you and even what you're doing when you're not, delivering babies.
It's a joy to be with you here today, Joseph. Thank you for inviting me. I've been in practice as a physician for 12 years, and I believe that God called me to specifically obstetrics and gynecology to be a voice for the unborn and mothers and fathers who are in a crisis pregnancy situation, really to stick up for those who are abused and who just need to know the hope that Jesus can offer, and also the gift of life, their own life and the life of the unborn. So I love my career has now transitioned fully to working at our pregnancy resource centers in Southwest Florida, and then I pick up some shifts at our local hospital helping out with emergency situations. And on the side, I love to sing and dance and act. And so any performing arts are my favorite hobbies.
Oh, that's awesome. We're gonna have to have a separate webinar about that.
Okay.
Yeah. Well, thank you so much for being here. We're so excited to have you. And thank you again to everyone who's joining us from around the country for our first town hall meeting. Again, just want to make note really quick. If you have a question, please email it to questions@savethestorks.com. And again, if we aren't able to answer it, someone will get back to you with an answer as soon as we possibly can. Also, you're going to find documents referring to today's call at the bottom of your screen. You can download those attachments and save them to your laptop. And we are also going to email them out and a recording of this webinar to everyone who registered. So thank you so much for joining us. Of these 4 town halls, we really felt the most immediate need, the most immediate felt need is serving your community in a crisis. You know, the coronavirus epidemic is certainly a health crisis, unlike anything I've seen in my lifetime. I think most people have not seen anything like this. It can be scary, both physically for our health, but also it's an economic crisis, and it's taking its toll on millions and millions of people, and it's probably going to continue to take its toll economically. As a nonprofit, we depend on donations, and you know, I've been in the nonprofit world for about 16 years. I've done nonprofit finance, and I've noticed that, you know, as the economy dips, that we feel that we really kind of are a gauge for what is going on in the economy. And you're likely wondering how you're going to pay rent, how you're going to pay insurance, salaries, and most importantly, above all, how you're going to continue to serve your community. We are going to be covering finances and budgeting specifically to pregnancy centers in an upcoming town hall meeting. But today we are going to focus on how can you continue to serve your community at this time and discuss what it might look like for your staff, your board, the public, and of course, most importantly, the moms that you get to serve. Becky, as an expectant mom, tell us a little bit about what are some of your concerns that you're facing right now?
Yeah, I mean, this is just such a crazy time to be pregnant and expecting. There's no, in any of the pregnancy books I've read, there's no, you know, advice on what to do to be pregnant during a pandemic, oddly enough. So I think the biggest concern, and what I've also heard from other mothers, is what happens if I get sick? How does this affect the baby?
Yeah,
Does it affect the baby? And there's so many precautions in place already. Should I, as an expected mother, be taking more precautions?
yeah,
Um, so those are, I think, the biggest ones. And there's just so much information, you know, you don't know which one to follow or what to listen to. So those are
yeah.
the biggest ones for me personally. So.
Yeah, that's excellent. Dr. Karysse, what are you seeing with your patients? What are some of their biggest concerns? And would you mind speaking to that and addressing some of those concerns and fears?
Absolutely. Becky, I'm hearing that same concern in the women coming in asking for abortions in our clinics. The world is in crisis right now. High anxiety, panic, fear are running through all of the airwaves around the world. And that's affecting women who find themselves with an unplanned pregnancy and already feel like they're in crisis. So it's a double crisis that our patients are facing right now. And I think it's our greatest time to shine as pregnancy resource centers, being a beacon of hope for these women, not only with the crisis of their unplanned pregnancy, but also with the extra stressors and pressure of COVID-19. And thankfully, there is a study that was performed in the Hubei province in China recently on 9 pregnant women who came in with COVID-19 proven pneumonia while they were pregnant. And those women were aged in the range of age 26 to 40 years old. And they were from 26 weeks gestational age until 39 weeks gestational age. And they all were very sick with COVID-19 pneumonia. And they, the doctors in this province in China, once the babies were born, they took samples of the amniotic fluid around the baby, of the placenta, of the umbilical cord blood going from the mom to the baby, and then also of the baby's nasopharynx, of the nose and throat of the babies. And praise God, all of those were negative for COVID-19 in the babies of the moms who had severe infections. So in fact, the womb is the safest place for any of us to be right now with this crisis.
That is incredible. Thank you so much for sharing. So just to reiterate that, would you say there's not, at this point, there's no risk to the babies that mothers are carrying for COVID-19?
That's exactly right. There is no risk, this study proved, to the babies of moms, even if they got COVID-19. And even in the breast milk, there was no virus. So
wow.
great
Oh,
news.
that is incredible. That is great news. And one of the reasons we kind of wanted to get into those fears is because you in the pregnancy center world, you're talking to these women every day. You're addressing each one of these issues. So that is a powerful study to be equipped with as you are talking with clients and meeting with them and helping them to make a life-affirming decision. So thank you so much for sharing that.
Wow.
You're welcome.
Yeah, that's amazing. And thank you so
Yeah.
much. I actually want to take a few seconds kind of away from this because right now we are in unprecedented times. There's so much fear and so much unknown, and so I just kind of wanted to run through a few resources very quickly that we are going to share with you, and this is really just to help you or someone else you know walk through a crisis. And so it can kind of feel you know like you're losing control, or these feelings that we have or these emotions that we have are not normal, when in reality when you're going through something like this it is normal and it's okay. And so I'm also trained in trauma and crisis care, so this is something that's really really big on my heart. And we really hope that these resources can serve you well. We will be going more in depth in these in the next upcoming weeks, so again I'm just going to run through them very quickly. But so the first one is actually a slide I'm going to show you from the sermon that Pastor Rick Warren with Saddleback Church gave earlier this week. So perfect timing. I think we all have heard about the different steps of grief. And these are very similar because actually a lot of the emotions that we're feeling is grief, and grieving what we don't have anymore and the unknown. And so, but this is called the 7 stages of dealing with a crisis. And so the first one actually is denial. This isn't a big deal. This isn't as serious as what we're being told. Dismissal, defiance. You can't tell me what to do. Delayed acceptance, disruption, distress, and determination. And this is actually a cycle. So this can change from day to day. When you turn on the news the next or tomorrow and you feel like you're like, you know what, I'm in stage 7, I'm determined to get through this, and then you hear news the next day and you go all the way back to delayed acceptance, that is normal. And so have grace with yourself, have grace with those around you when you're like, you were fine with this yesterday and you're not fine with it now. It's a normal thing, and it's a process. And so the next resource I'm going to run through very quickly again. You can download all of this if you just click below, download the link. Keep this handy for the next upcoming weeks. But this is just 8 essential steps during a pregnancy crisis. So sorry. One is control your worries. That is one thing that Dr. Karysse talked about, is the fear that is running rampant. Don't let the fear take control. So control your worries, consult and coordinate. Don't act in haste. That is one thing that fear tries to make you do, is just to act without taking a second and breathing and asking yourself what is actually needed here. Establish a core team to handle the matter. Have a central contact person or group for information. You don't have to do everything on your own, and don't feel like you have to. There's a community around you. We're here for you. And also pay attention to fatigue. Over communicate and pay attention to your core values. And what that is pay attention to your core values. This is what will be driving you towards what you're being actually called to do. If you focus on those core values of yours versus not what fear is wanting you to do instead. And so if you just keep those core values ahead and in front of you, no matter what the world or fear is wanting you to look at, you know what your core values are. You know where to look. So again, all of this you can download below, and we'll go through it more in depth, but I wanted you to have these resources now to look through, especially in the upcoming days as more information is being shared with us and things like that. So thank you for just letting me take a few minutes of your time.
That's excellent. No, and I think it's excellent, and I think it's more relevant than we even know. In fact, just today we were talking with a center who is saying, I don't really know what's going on with my board. They're typically really helpful, really, helping me lead this organization, helping me lead the community, and they are just stuck in crisis and they're not stepping up, and being the leaders that I know they can be. And so this is really helpful for us to walk through this and say, which of my board members, which of my staff, where are they at in this process, and what can I do as a leader to help them to manage these emotions and help to alleviate their worries and their concerns so we can get back and focused on serving our community. With that, Dr. Karysse, I know a lot of centers have been struggling with the lack of resources, limited abilities to be able to serve women. How has your center been affected by the shutdown, and what are you guys doing to serve your community during this time?
I think our center has been affected that in the way that some patients are feeling like they either need to immediately go to Planned Parenthood and not hear us, or that they're just bursting through our doors demanding immediately an abortion because of this crisis. So I think the acuity or the desire in patients to find a quick solution to what they perceive as a problem has raised through this crisis. And so I think it's important that we allow them and even our board members to vent and express how they're feeling. In a trauma-informed care model, we support the emotions of those we're working with, whether it's our patients, our staff, or our board members. So first of all, I just want to encourage us all to say, tell me how you're feeling about this crisis. Let's talk about how you're feeling and just give a brief moment for people to vent and then echo back to them. That's normal to feel that way. Even though you're leading an organization, it's normal to be afraid. It's normal to not know what to do. But like Becky said, we're going to choose to trust that we are on the right track, that this is where we are called to work and to live. And so in order to continue to keep the donors interested and keep our donor base interested, we're sending out special email alerts about how important this ministry is at this time, because so many churches are closed and other resources that these pregnant women in crisis could maybe turn to, those places are closed down. So this is really our finest hour at these pregnancy resource centers. So I want to just encourage PRCs to send an email to their donor base saying, this is our finest hour and we need your support like never before.
That's excellent. Let me ask you, so is your center open currently and seeing clients, or what does it look like? Kind of just your day-to-day, what does that look like since the shutdown?
Yes, I have 2 clinics in our setting. Both clinics are open full time. We've had some advocates who are elderly or feel uncomfortable being in the public with coronavirus step down at this time. And we celebrate all of our staff and employees and trust their wisdom and their decision making. So we're not putting any pressure on anybody to have to come to work. But for those who are willing to come, it's enough to fully staff both clinics. We don't have all of the personal protective equipment that the CDC is recommending, but most hospitals also don't have that equipment right now either. So as a clinic, we're allowing staff to come in with their own masks if they feel most comfortable wearing their own mask, but we're only providing CDC grade masks, gloves, gowns, if we have them. And if we don't have them, then we're letting our staff know that they can stay home if they don't feel comfortable serving at this time.
Yeah, that's helpful. That's very helpful. What other processes and procedures would you recommend to centers who are staying open during this time so that they could still effectively see clients? Like, what are types of processes and procedures? We know hand washing is really important. What are some other things that centers can do to ensure that they're staying safe while they're open?
Great question. First, we're screening all of our patients before they arrive. We're calling them and saying, do you have any symptoms of COVID-19? And if they do complain of severe symptoms, fever, cough, fatigue, malaise, we're sending them to the urgent care first to get checked for COVID-19. So if they're not having those symptoms, then we reassure them that our center is sterile and as clean as we can be. So first, we're screening our patients. Second, we are wiping down all of our door handles and areas that patients sit between each patient. And then we are moving our clients or our patients with a little space between. We usually double book or have them back to back, but we're leaving a little space in between so that we have room to clean and to spray Lysol when appropriate. And then all of us, we have a hand washing protocol now in place. When you enter the clinic, you have to wash your hands, and of course, wash your hands between each patient.
That's excellent. That's so helpful. Thank you so much for sharing that. Becky, why don't we open it up at this time for some questions that have been coming in?
Yeah, we have some great questions coming in, so hopefully we can get to them all. But if not, like Joseph said, we'll have someone reach out to answer your question for you. So one of the questions that we're getting a couple questions about was, can you repeat what study you found about the babies were fine with the moms if they contracted COVID-19?
Yes, it was published in the Lancet, Lancet. That's one of the distinguished medical journals in the world in February. And it found no risk of coronavirus in the offspring born to infected mothers.
That's wonderful. Yes, thank you so much. I think that was a huge resource to be able to kind of hand out and also speak to the expecting mothers that are coming in.
And I can send that link to Storks and you guys can add it somehow to this.
I was going to say that, yeah, if we can get that, we will send it out to everyone on our list here. That's excellent.
That'd be wonderful. Awesome. One of our questions is, so something we were just talking about, PRC is limited with the personal protective equipment and the nurses can't come in because of health issues. How can they serve the community when they're worried about their own health? So are there other ways that maybe they could be serving, or what are your thoughts?
Absolutely. That's a great question. I think there's two ways. One, we can still be on the phone. We can still do telemedicine where we either have the patients call in and talk to a nurse via the telephone, or we can, there's ways that you can set up, if you have a webmaster, you can set up video conferencing similar to something like this so that you can have a specific face-to-face connection with the nurse, or if you have a physician at your practice.
Perfect.
That's excellent. Can I jump in there real quick, Becky?
Yeah,
I would also say, get creative during this time. You know, really, this is an opportunity for pregnancy centers to be seen in your community as a community resource. You know, so I'll just throw out really quick that we know of a couple centers who are, you know, still giving out pregnancy tests in a drive-through setting. They're still giving out, you know, all the resources that they typically do. So diapers, baby clothes, formula. They're just doing that in a very safe way and often through a drive-through. Yeah, and there are others that are, you know, some of our mobile affiliates are using their stork buses to deliver food, to deliver supplies. So I just wanted to throw that out there that this is an opportunity for us to be seen as a resource, even if we can't, you know, or it's difficult to do what we typically do. There's a lot of centers that are getting really creative out there, which I love.
Oh, I love that. And we've had a couple PRCs ask about how can they possibly go do telemedicine. And so I didn't know if you knew kind of the steps for that to happen, and yeah, and any information would be great.
Yeah, so if the patient is, I think the most important thing is to make sure that the patient feels comfortable talking via the internet where potentially a third party could be listening. Not many of our clinics have HIPAA compliant telemedicine in place right now. So just letting the patient know from the get-go, we this is not a secure server, but we don't think that we're not aware of anybody who's listening in. And if you're comfortable with that, knowing that, then we're here to help you. So if they're comfortable with that, then you can use FaceTime if they have a phone and one of your advocates wants to use their own phone. If you're doing video conferencing, you could also use Zoom or Skype. There's lots of video conferencing availability just on the internet.
Okay, that's amazing. And you mentioned being HIPAA compliant servers. What does that look like for any of our pregnancy centers that might already be medical, but they don't know how to kind of transfer over to being a HIPAA compliant server?
So what I would say is contact whoever takes care of your IT. Usually a PRC will contract with an IT company that helps them keep their IT up to date. That IT company can help figure out a HIPAA compliant video conferencing solution.
Okay, perfect.
That's excellent.
Yeah.
Oh, go ahead.
Well, I was going to say, I think that's about all the time that we had. We had a few more questions, but I think that's about all we had. But you can correct me if I'm
Excellent.
wrong.
Yeah, absolutely. And if you have any further questions, please continue to email us at questions@savethestorks.com, and we'd be happy to answer. Man, this time has gone by way too fast. I'm so grateful for everyone that joined us today, and a special thank you to Dr. Karysse. Thank you so much for joining us today.
It's my pleasure, and hats off to every PRC who's listening and who is still in the fight. God bless you all. I'm so proud of you.
Thank you so much. Yes, I agree. The materials that we presented today, along with the checklist to help guide you through, it will be emailed to you. You can also download them at the bottom of the screen. If you would like prayer or have any other questions, please email us and someone from my team will follow up with you as soon as possible. Be sure to tune in next week, where our topic is going to be financial management during uncertain times. We are so excited to share with you some of the things we've learned there. Again, thank you so much to everyone who's joined us today. Thank you, Becky. Thank you, Dr. Karysse. Know that we are all praying for you and we are for you. Thank you.